Hi, my name is Eileen Dow, and I'll be doing my health policy video on car safety seats. First, to define health policy. Per the Health Policy Application for Nurses and Other Healthcare Professionals, 2nd edition textbook, author Demetrius J. Porch, and I quote, "The term policy can be used to refer to standing decisions or principles that serve as guidelines for actions. And health policy consists of policy that impacts the health of individuals, families, populations, or communities." I'll be discussing the new guidelines for the car safety seats, also known as car seats. In 2018, the American Academy of Pediatrics, the AAP, issued new car seat safety guidelines. Dr. Benjamin Hoffman, the lead author of the American Academy of Pediatric Policy Statement and the chair of the American Academy of Pediatric Council, along with his co-counsel, Dr. Dennis Durbin, released the new guidelines. One of the biggest changes in the guidelines, which you can find in their website in the AAP.org, was the age in which a child's car seat was to remain rear-facing. According to the AAP website, the recommendation used to be 2 years of age, but parents tend to switch their kids to forward-facing a lot sooner than that. The new recommendations states that a child must remain rear-facing for as long as possible, 2 years or older, up to 40 pounds, which many of the car seat manufacturers have increased their weight limitations to go with these new guidelines. The reason why the AAP issued this change was due to a study that proved that a child's neck and head were not as protected forward-facing as they were rear-facing at this age due to the way the head is thrown forward if forward-facing when a car is struck during a car accident. As a child gets older and exceeds the weight and height limitation of the rear-facing recommendations, the child is then to be placed in a 5-point harness car seat forward-facing until they reach the height and weight limitation of their car seat, and some could reach up to 65 pounds. Which both my children are in this 5-point harness forward-facing car seat. The third recommendation is after the child has outgrown his or her car seat, the child must ride in a booster seat with the seat belt from the car seat from ages 8 through 12. And the last recommendation, which is a 2-part recommendation, is after the child has outgrown their booster seat, they should use the lap and shoulder seat belt. Which is really a recommendation for everyone because it's the law to wear your seatbelt. But the second part of the recommendation is that children under 13 should ride in the back seat because of the harm an airbag could cause if the child is not tall enough or big enough to sustain the impact of an airbag during a collision. Despite these recommendations, car accidents are still a leading cause in death in children ages 1 through 13 due to the child not being properly restrained, according to the National Highway Traffic Safety Administration website, the NHTSA.gov. But with that said, the new recommendations have been effective, reducing the risk of death by 28%. And despite all the resources out there, parents are still not asking for help when installing a car seat. According to Dr. Hoffman, 95% of families leaving the hospital with newborns make serious mistakes. There are several websites available for free that have the new guidelines described in detail. One of them is the National Highway Traffic Safety Administration, the NHTSA.gov, which has very useful tools, some of which I have used personally. In the official NHTSA website, a parent could find the evidence-based guidelines. A very useful tool that I found in that website when trying to decide whether or not my 5-year-old should be transitioned from this 5-point harness car seat to a booster seat was a search guide in which I put my son's birthday, height, and weight, and it calculated which type of car seat he should be in. My 5-year-old son is currently 46 pounds, 4 foot 5 inches tall, and it said that my child could safely be in a 5-point harness car seat or a booster seat, but since he's still under the weight limitations of his car seat, he will remain to ride in this 5-point harness car seat. Another tool that I found and that I have personally used in their website, which is a great resource, is searching for locally for a child passenger safety technician. Now, there are misconceptions out there about taking your car seat to any fire department to be installed, but that is not the case. An individual has to receive the proper training and certification from the National Highway Traffic Safety Administration in order to be able to assist you with the car seat installation. Technicians could be found in the fire departments, police departments, or hospitals, but you have to research and make sure they're certified. There are also local safety car seat events which are held regularly to have the public come and get their car seats inspected. Parents could search for upcoming events in the NHTSA website. It's very important to not only know how to strap your child into the car seat, but to properly install the car seat into the car. As Good Morning America reported on their website recently, a Minnesota mother, despite strapping her child correctly into her car seat, failed to install the car seat properly into her car, and when she went around a curve, the child, still attached to the car seat, flew out of the back seat without the mother noticing, and she kept driving. The child was unharmed, but the mother is facing charges for not installing the car seat properly. There is a step-by-step guide or video on how to install each of the car safety seat properly in the website that I mentioned. I know one thing that I struggled when I first became a mom was knowing how tight the strap should be and making sure that my child was right in their car seat properly. But now I understand the importance of having my child restrained properly. These guidelines are evidence-based, meaning the research that was conducted concluded that a child would be safer when following these guidelines for car safety seats.